Hey guys, Andrew Dowling here and Mitch Kurtz. Thanks for joining us for another episode of the AltMed podcast. Make sure to hit like and subscribe because we've got heaps more content coming out and it's really fun and great and we love it all. Also very good. Hey guys, welcome back to another episode of the AltMed podcast. My name's Andrew Dowling. My co-host is beaming back at me on the screen right now. It's Mitch Kurtz. You're looking fresh, Mitch.
Thank you.
It's pretty good because we're recording this at the end of the day. We've got a very special guest joining us today to talk about all things to do with integrative medicine. We have the founder of Your Integrated Health. It is none other than GP Dr. Carolyn Bosak. Carolyn, welcome to the show.
Thank you. Thanks.
We're very excited because I think we've had different touch points along the way with the topic of integrative health, as you'd expect on a podcast titled AltMed. But yeah, I know you've got you draw from, quite a range of experiences in different areas that encompass integrative health. So maybe we'll kick off with, your background and how you fell into becoming quite a prolific authorized prescriber of medical cannabis.
Well, I suppose it should have been a logical progression that I ended up in medicinal cannabis. So integrative doctor, I was working at NIM. That was one of my jobs, but I can't say that that's what led me there. And embarrassingly or ashamedly, it didn't even lead me to medicinal cannabis when one of my patients, so in the clinic that I was working at, she was an elderly, not elderly, in her 60s, multiple sclerosis, been looking after her for years, walking frame, chronic pain, poor mobility, and she was on, pharmaceuticals as long as your arm. And she chanced upon a trial at the major public hospital nearby, and with medicinal cannabis. And I can tell you that she didn't get placebo because she walked in one day and she was without her frame, and she said, "I feel amazing," but she said it's going to come to an end. And so I think the trial was 3 months. She said, "I won't be able to afford it," and we sort of had a little, bit of a tear together. But even that didn't. I just didn't even know it was an option back then. So this was a few years ago.
Wow. Okay.
And it wasn't until that there was a startup company that was establishing itself, and they needed doctors. Someone that I knew was doing their marketing and said, "Oh, they need doctors. Do you want to have a chat?" So I had a chat, and so they asked me, "Do you want to do the training?" And I said, "Yeah, why not?" And basically within minutes of learning about the endocannabinoid system, because I didn't know anything about the endocannabinoid system, I thought this is going to be amazing, and it has been. So what started off one day with them ended up 2 days and 3 days, then training all the doctors that went through there, and then so then ended up leaving them, doing a bit of work with the rock star of medicinal cannabis here in Melbourne, James Stewart. And
Mitch, I've heard you describe yourself as that. Anyway, I'm a bit confused now.
That's not medical. That's
So that's been a blast. But yeah, now I'm leaving him just so I can concentrate on this clinic that I've started up. So yeah.
No, that's absolutely fascinating. I must admit, I just assumed that the National Institute of Integrative Medicine, NIM, was because I recall in the early days that was Australia has something now like nearly 2,000 or maybe more than 2,000 authorized prescribers, and I remember they were assisting doctors in those early days. So I just thought they might be right at the forefront of that. Interesting. Well, yeah. So what does your practice look like at the moment? So which kind of patients are you seeing?
So I see, like I always say that, like I'll see anyone and anyone and anything, any condition, any age, any stage. But the thing that I really concentrate or sort of specialize in is complex, difficult cases that you haven't had your answer through this, that, and the other doctor or treatment, and particularly women's health. So I think, when I started in medicine, I had this terrible GP teacher saying, as a female doctor, you're going to end up with all the tears and the smears. And so I went into medicine, went into general practice thinking, I'm not going to be that doctor. I'm not going to be that women's health doctor. But it finds you, and I love it now. Like, I love women's health. So yeah, the complex cases, and so medicinal cannabis is fitting quite nicely with that. It's a good tool to have.
How does medical cannabis fit in, with mainstream medicine, so to speak? So it's we often hear of it referred to as like an adjunct therapy, let's say.
Yeah.
But how does that look in practice? Like, can you give us examples of how that might actually play out in practice?
Yeah, so I'll go say from my perspective and my experiences. I usually receive patients. So it's either by word of mouth. So they've struggled. They've got particular conditions or symptoms that no one else has been able to help them with. So they either get online, they'll get in a forum and decide, medicinal cannabis sounds like a possibility of helping them. Or it'll be word of mouth. Someone will say, oh, have you thought about medicinal cannabis? And so these patients will then often go to their doctor as the first port of call, and they're often shut down by their doctors. And there's different reasons, and I've heard them all. So some doctors are they don't know enough about it, and that's the end of it, and they don't really know where else to go. Some doctors are dead against it. I've had patients, kid you not, who've been dropped by their doctors because they've embarked on the medicinal cannabis journey.
Wow.
And it's phenomenal. And there's just,
that stigma. It's like, we know it's there, but I thought it was real. Kind of dropping like a bit.
No. And
okay.
And then and so then what'll happen? So say some, and then there's sort of the reverse of that, where you get some specialists who deal with the very difficult, complex, particular conditions where mainstream medicine hasn't come up with the answer. And I noticed the same names because I always ask, who are your treating practitioners, and I see the same names, and so they're funneling patients through, but there's never anything in writing. So clearly they don't want to put, a name to it officially, but it's great that there are some doctors. But I had this case last week. So this particular lady, young woman, she been admitted, so she had an inflammatory bowel condition, so Crohn's. So do you know Crohn's disease? Anyway, so it's an inflammatory bowel condition, autoimmune, and she'd been admitted to hospital with acute abdominal pain. So this was a new diagnosis. So she didn't know what was going on, admitted to hospital, and ended up that she was diagnosed with a perforated bowel, full of pus, had surgery, so had a lot of her bowel removed. And then had a drain, had a tube. She couldn't eat for 8 weeks, so she was in hospital for 2 months. Was being fed through a tube for 8 weeks, and then managed to get home. But home was hospital in the home, so she had a vacuum drain, and that drain had to be changed every day. So she was supposed to have hospital in the home, where she would be visited every day, and the drain changed because she'd told them. So she was on medicinal cannabis oils, but through another prescriber, not myself, but was using flour illicitly. So she was honest when she told them that she was using oils, prescribed oils and flour, and they refused to come and see her at home. So what that meant was, she's in a lot of pain. She's very deconditioned. She's been in hospital for 8 weeks. She's come home, 8 weeks of a drain, and so she had to hop in an Uber every single day for 8 weeks because it was the response was that you are potentially putting us at risk. She's written to the hospital, she's had no response, and it was just, and that's the stigma that's still out there. And
that is absolutely wild. I mean,
it's wild. It's wild,
yeah.
all right.
Yeah, I think that's disgraceful. I mean, just the duty of care that the treating doctors had, and they've, effectively walked away from that. Although I suppose you're well placed to answer the question, like, are there any potential implications for doctors from, I guess, a professional indemnity insurance side or something like this that would prevent them from engaging in the sort of primary healthcare?
Such a lawyer question.
Yeah, sorry. I put it to you, Dr. Bosak. No,
So what do you mean? So what do you mean?
So like if for example, it sounds like they were basically saying, there's professional implications for us as doctors if we are to treat you because you're
well, it was more than it was more than nursing staff. So it was the nursing staff who decided. So so they run the hospital and the home. Look, I don't know who was involved in making that decision, but she seemed to think it was the nursing staff, and the answer was, and she tried to fight it. She's a feisty young lady, and she said, you actually realise that cannabis users are the opposite of violent, because that was the implication, was that there was the potential for violence. And
wow,
yeah, so
that's incredible. I mean, there's some really strange things that have actually been coming to light recently, just more broadly than cannabis. I've learned recently that, certain public hospitals that are, Catholic have codes that are religious that prevent access to women's health services and abortions, these sorts of things. I think people would be shocked to learn where healthcare is not being delivered in Australia. What circumstances give rise to that?
I think, and I think a big contributor to this particular scenario is the fact that we can't actually speak in any meaningful way about our experiences with it. Like, if we were able to speak publicly about our experiences, I think that would go some of the way to breaking down this barrier and this stigma. But the fact is, as you know, some doctors took the hit recently, and some companies took the hit, and it was clear to see these doctors were patient-centered in the things that they were speaking about, but we're not allowed to promote, medicinal cannabis and its benefits because it's unapproved. It's sort of a catch-22.
Thankfully, there's AltMed podcast. You know what I mean? Like, just thank goodness. You know what I mean?
Nice little plug there.
Getting around.
Yeah, I don't know if we're above the law.
Plugging on our own show. No, it's a very it's strange that, and we see it all. The obvious one that I think, you'd have more experience than us with, but is patience. An example of that is patience, and driving, of course, is just like a crazy one. That's one of the most prohibitive factors in prescribing someone cannabis. So is that true in your experience as well?
Yeah, so it's the central, I suppose it's the central theme of or choke point. So it changes what you do, and there are certain conditions like, that where THC is the beneficial cannabinoid, and, it's a decision that people make, and between symptoms and no symptoms, or, taking a risk, or, it's a hard one. And so a lot of talk happens about that.
I'd actually love to extrapolate on that, because it's a question we get asked a lot, and it's better coming from somebody qualified to speak about it. But what conditions would you actually prescribe THC instead of CBD? Where is the benefit coming from that you would actually choose that instead?
I think, look, it depends on the type of pain, I suppose. So I suppose, as we know, chronic pain's the major or the most common reason we prescribe cannabis, so medicinal cannabis. So, but it's the type of pain. So neuropathic pain, nerve type pain, and of course the more severe levels of pain. CBD doesn't quite get to, it doesn't cut it. If someone's naive, if they're cannabis naive, I would always at least try CBD on its own, but counselling the patient, saying you're probably going to end up needing, or at least to consider, THC. Spasticity sort of goes along the lines with that, nerve dysfunction. And particular endometriosis. So even though CBD can have benefits, THC is quite, and I see a lot of endo patients, is quite beneficial. A lot of patients actually have found that they've discovered that on their own. They often come to you already having, using it.
Yeah, well, it's interesting as well that
sleep.
Sleep. Yeah. And as well, I've heard anecdotally people who, I guess find ways to ingest THC, where maybe it's as simple as a capsule with THC dominant oil in it, such that they can, potentially evade the testing, but also get the medicine that appears to help them quite a bit. But these laws are just outrageous when you think about, for example, people living in regional communities around Australia, and you need your car. People in the city obviously need their car to get to work too, but your car is your ability to actually get to your work or anywhere in regional communities, and so many people that we hear about have lost instant loss of license, attend the magistrate's court. It's something really does have to change. And I know that there are some really good people in the industry that have been pushing for that in the Drive Change campaign.
Well, that research is phenomenal. That's, really sort of explores all of the possibilities and all the arguments against legalizing. It's quite amazing. I quote that sort of stuff all the time. Tom's research, and it's useful, but not useful enough at this stage. So
yeah, indeed. Now, just jumping, I was going to jump around a little bit all over the shop today, but yeah, just jumping back to women's health. So I'm just curious, what are the main conditions that you will see people with for? So I know we've talked about a little bit about endo, but does medical cannabis help? For example, I was doing a little bit of research on you, and I saw you've worked a lot with, things like Implanon and IUDs and that sort of thing.
Yep.
Any pain or issues or mood issues that come from sometimes those devices? Is that something that would fall within the sphere of women's health medical cannabis?
Well, just more, I suppose, more along the lines of the hormonal imbalances that cause those symptoms. So more along the lines of premenstrual dysphoric disorder and severe PMS, menopause, and, endometriosis and issues with polycystic ovaries. So the hormones, if you go back a few steps, a lot of these women's health conditions, you can actually find origins in endocannabinoid deficiency. So
right. Okay.
That's why, and then back a step again to gut and vaginal microbiome dysfunction. So that's why medicinal cannabis can work for these conditions. And so I suppose in my experience, with integrative health and medicinal cannabis, the commonest one would be endometriosis, because it causes so much pain and disability, and there's just, mainstream medicine hasn't come up with the answer for that.
Yeah.
But menopause as well. And it actually, Ethan Russo, so he's, neurologist and famous, cannabis
We had
expert.
him on the podcast.
Well, he did he talk about his beautiful paper on the use of medicinal cannabis in obstetrics and gynecology from the beginning of records.
Oh,
So
wow.
it
yeah,
is brilliant.
yeah.
So it basically has been used in all the ancient civilizations for, you know, labor, for breast issues, for, you know, excessive bleeding and period pain. And so this is going back to, you know, the earliest record of it being used in women's health was 3000 BC. And so he chronicled the use of it to the present day. And it's just basically been used, you know, in every which way. You know, they mixed it with, you know, herbs and vinegar and lamb's fat, and used it, you know, in orifices and on the skin and by fumigation. And but it has been a constant since the start of time. And the fact, I just think with that, the fact that it has been used for that amount of time in so many different ancient civilizations over the world, to me says that it would provide some sort of survival advantage, because back in the day, they did not do anything unless it provided a survival advantage. So I have this interest in evolutionary medicine, and it provides a lot of the answers to the problems that we have today. And that paper just, it was beautiful. Yeah. And yet there was this great quote at the end of it. There was a few quotes, but one of the quotes was someone in at the late 1800s, and he was a gynecologist, obstetrician gynecologist, and he wrote about all his experiences with using cannabis in women's health, and then about his colleagues' experiences, and how great it was. And he said, it deserves a further trial. And I thought that was really funny, because we're still there. We're still there.
We sure are. And it's like, yeah. Sorry, you go, Mitch.
No, I was going to say that it's such an interesting one. That cohort in endometriosis is a very impassioned cohort. I think they feel like it seems to come across like they feel very helpless at a lot of times. There's a very strong social media movement. There's a lot of women suffering a lot. And, you know, there's always ads on Facebook for strange contraptions that you put on your body, and like devices that sends electro signals. And there just seems to be all very experimental things going on in that space, let's say, because it is so complex.
Oh, they're desperate.
Yeah, they're desperate. They're absolutely desperate, and it affects so much, you know, from intimacy to reproduction and the rest, beyond just the pain, that it's debilitating. You know, it takes a lot of people's seemingly part of their womanhood to some degree. Is
and they often can't
it's
work.
been explained to me.
They often can't. You know, not just because of the pain, but it actually has some sort of cognitive effect. And so their memory's impaired and their thinking's impaired. Like it affects everything. And you know, that like
a reproductive migraine.
Yeah. And you know, sorry,
I was going to say, are there any anecdotal evidence or anecdotal kind of anonymized anecdotes is what I was looking for, that you could share with us about people getting benefit from this particular condition?
Oh yeah. So I had someone, she was in her 20s, she'd had, and this story's sort of repeated over and over and over. So and they've discovered it for themselves, or they've come to you first time because they've read it on forums, on endo forums. So I had someone who read it on a forum. She was in her 20s. She was trying to study, but just her quality of life was just so poor, and she couldn't attend very well because these women miss out on a lot of days of study in school, and they have hospitalizations because of acute episodes. She'd been on opiates. She'd had probably like 6 or 7 endo surgeries, and so each time they do an endo surgery, yes, they're getting rid of some of the tissue, which is responsible for the pain, and it can have 6 to 12 months of effect. But at the end of the day, going into the peritoneal space every time it can result in more problems. So it's not the answer. So because it can cause more scar tissue, which causes pain. So the endosurgery thing is just it's a band-aid. The hormonal treatment usually causes side effects. So she tried everything, I started her on CBD oil, and she actually had an amazing effect. And because I have to say, in my experience, the endo patients usually need some THC as well, but she did quite well. But then, a lot of patients come to me and they've already discovered it. So they've already discovered it for themselves, and they want to legalize their use because, they may have children. They don't want to have to deal with criminals, that sort of thing. It can be hairy sometimes to obtain it. So,
well, and it's funny too, because if they were in another country in the OECD, say, Europe, UK, North America, they'd be able to get at least CBD oil, and often CBD oil with low amounts of THC as well in it. They'd be able to buy that retail. But here in Australia and also New Zealand, you need a prescription, and this is notwithstanding that CBD among all other cannabinoids other than THC is non-intoxicating. So, riddle me that. I truly do not understand the framework at all in that respect.
Well, the other thing is the trials are happening at the moment with potential for it to, it's been descheduled. So we're going from can't speak about it, to, you can go and see your local pharmacist to get it. Look, I don't know how close that is. From what I've seen so far is they're not getting the results.
Because of the trials. Is that the 150 milligram daily? Limit is.
There's such limitations with all that. So
arguably designed to cause a high failure rate. It's it's totally it is bonkers. But I was disappointed to see that New Zealand recently, I think a couple of days ago, decided not to down schedule CBD. So they're basically following in the same footsteps as Australia for the time being. But it is funny just tracking the I guess the evolution of everything. Pre 2016, it was you can't prescribe that. If you want that, you might be part of some highly regulated, supervised clinical trial that has handful of people that can get into it. And then it was like, well, we'll open it up, but there's going to be multiple permits from your state Department of Health and approvals from the Commonwealth. And, so you're not going to be able to get it that easily. And all along, you can't talk about it. You definitely can't, because that could be, advertising, and we don't want anyone to be promoting it or anything, because it's unapproved, hasn't had multi-million-dollar phase 3 clinical trials. And so we're just kind of slowly but surely
2 steps forward, 1 step back.
Step
forward, 2 steps back.
Exactly. Just each step of the way. And I think as well, I sometimes think about the people that are tasked with regulating it at all the different agencies, and they must, to some extent, at least my working hypothesis is, a lot of those people, I imagine, must find it so tedious to have to enforce the framework that we currently have. But hopefully, hopefully we will start to see access and even just the ability to talk about these things improved. But I want to touch on other parts of your integrative practice. I thought I saw elite athletes. Is that, and you mentioned your connection with Dr. Jim Stewart. We won't get you to name any names of any stars that are in that you're seeing as patients, but I'd be just curious to hear from you about what that side of the practice looks like. And do you for elite athletes, do you need higher levels of CBD because they might be dealing with, you know, more inflammation than others?
No, look, I suppose I need to clarify that. So I look after elite and age group athletes, like any athlete.
Yeah.
And
so you would see Mitch or something, even like, is that?
That's creme de la creme, mate. I'm impervious to inflammation at that level.
Look, my
is that because you don't
that,
exercise? No, sorry.
Possibly.
Yeah, my interest with athlete healthcare started for personal gain. So
the honesty.
I'll admit. So with my sport, years ago, I noticed that you know, hormones affected my ability to perform, and so I went head down, bum up in researching it and performance in general. So and then just, you know, I was banging around my club about things, and then my coach said, do a talk, and I did a talk, and then it just sort of led to one thing after another. And so athletes started to come to see me, because when you look after an athlete, it's a bit different to a non-athlete, because you just do things a bit differently in general practice. And so the cannabis side of things, so I actually did present in Nimbin recently, of all places, on medicinal cannabis and sport. And it's all, I suppose it's a pipe dream at the moment, because it doesn't come under the whole you know, the TGA framework. So it can in the I suppose if you've got an, you know, chronic pain, or it has to be a symptom of, but we know, you know, definitely that it can help with many aspects of recovery, and, you know, recovery from training and competing, and injuries, and concussion, you know, the anxiety associated with sport. You know, it's got endless, all of the downsides to sport it can potentially help. And there have been trials to support this, but we're, you know, at the phase where, number one, we can't really use it for an athlete just because. So you're always, it's only for certain indications. And the other thing is that, of course, you know, that it hasn't been legalized in sport yet.
Well, isn't it? I think CBD maybe got added to the wider safe list, but it's highly risky unless you're taking an isolate.
So I mean, you know, certain athletes they won't even go down that track anymore because of.
Although, riddle me this: is there any sport in the world that THC would actually be performance enhancing? Because that's the part about the wider code I don't understand. I'm thinking. I mean, sometimes so I'm an Essendon supporter, and they're playing that badly at the moment that I'm wondering if they're getting on the THC before the games, and it's just, they're not good at the moment. But yeah, I don't know.
I think in terms of THC, I think it's just those sports that rely on technique and flow, like skateboarding and skiing and surfing. It can be performance enhancing for them because it reduces muscle tension and anxiety. But for most other sports, it's actually performance detracting.
Yeah, totally. And so you're, by the way, so when you were looking into this, I'm just curious because we do spend a lot of time talking about the potential therapeutic value of medical cannabis for some people who are eligible and who don't have it as a first line treatment. So I'm just saying all the usual things that need to be said. But
same things I say.
Yeah. In terms of this being an AltMed podcast, have you looked into, you know, ice baths and like other forms of recovery as well, and even integrating that with medical cannabis for recovery, or what are some other alternative or integrative approaches to sports medicine?
So remember, I'm talking medicinal cannabis and recovery is the theoretical. So I don't actually prescribe it for that reason. But in terms of definitely know that there are sporting bodies that are looking at using it and do use it. So the way it can work in with other things are, I always start with diet. So diet, high in antioxidants. And I think if you were going to put one thing top on the list for your recovery, it's what you're putting into you. And I profess that from experience. So as a older athlete, I am able to do endurance sports, so Ironman, with no supplements whatsoever. So, and that's just diet. And I talk about 80-20, 80% good, 20% fun. And it's diet. And then sleep's important. In terms of ice baths, so yeah, you can do the hot and cold therapy. And so they're good for sort of, I think, when you've got you've got to back up your training or training after a competition and you're quite sore. But what that actually does, so you wouldn't do it in the long term, because that actually prevents what we call adaptation. And the whole point of you training is that you break down muscle and then rebuild as part of that, and that gets you fitter.
Right.
And more resilient. So when you use these things like non-steroidals, anything that reduces inflammation, if you use it in the long term, actually can reduce your adaptation. So these are things that you use in short bursts. So the things that you do in the long term are all of those things that we talk about with our endocannabinoid system optimization. That's diet, stress reduction, sleep hygiene, reduce your exposure to toxins. So I put a lot of focus on that, and I put a lot of focus on the pre-training and competition and post, because that makes a big difference to your recovery. Have you got enough energy on board before and then immediately after, and then you can back up and I've put all this to the test.
That's amazing. So you do.
Also,
sorry, I just want to hear just very quickly about these competitions. So what kind of distances for those listening that would be?
Oh, mate. So I mostly do half Ironman, and you can only do an Ironman every now and then. Well, at my stage of life, so my next one will be next year. But so Ironman is 3.8K swim, 180K bike ride, and then a marathon. And which is 42K run.
Yeah, wow.
So, but most of what I do is half of that. So the 21 half marathon, 2K swim, and 90K bike ride. But it's a full pelt. Like you.
I was going to say that sounds so much easier. Like, that's, oh my God.
Yeah.
I'm just curious, with regard to the inflammation piece, are you saying there's possibly the potential of CBD, let's say, reducing the ability of you to build muscle, anti-inflammatory?
That's not so much the building of muscle; it's the adaptation of that muscle. So when you break down muscle and then repair it, it comes back a little bit better at withstanding, a bit more of a load. And so just by the factors that get released with the inflammatory process. So CBD, yes, and I've looked into it, and there seems to be a suggestion, but there hasn't been enough study, as usual. There is the suggestion that if you use it in the long term, that it can reduce adaptation, just like anything else that reduces that process, reduces that inflammatory, breakdown, rebuild process.
That's interesting. I'm also curious. I mean, obviously you can't do this because cannabis is not only a therapy, but it's not a first line therapy currently. Yeah. But from your perspective, talking about input versus output, could you ever see cannabis, especially on the CBD side, as a supplement or like a preventative tool or something? We have like fish oil, let's say, where people use it to supplement their kind of holistic health as an everyday practice.
So I suppose I think I was asked that question once a lot. I was alongside with Peter Bruckner, and I said, I said, this is my opinion, is that you do it through every other means possible before you rely on something. That's just me and my approach, because I think if you're doing all that, then everything else about your physiology is going to be tip top. So I know that when I went to Kona, that one of the recovery supplements was CBD, and I thought I didn't know much about it back then, and so I thought I didn't know if I could have it before the race. So I waited till after the race and had it, and it definitely would have had THC in there, which because of the reaction that I had. So I was up all night saying, "Oh my god, I'm going to die, 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 I'm going to die." And I actually didn't look at what, to tell you the truth, I didn't look at what was in this sachet. I just saw all these, turmeric and that sort of thing. So it is being used in that way. But I think, being unregulated, and the fact that, the THC extraction process was obviously not great, that definitely had THC. So it's definitely being used in that respect. Do I see it? Yeah.
I'm kind of thinking of it more like, branch chain amino acids or something like that, where people take it, as those types of people take it for the gym, let's say, and then other people would take it as a wellness tool or before sleep, or this kind of, we do see CBD in other jurisdictions being widely accessible at the supermarket kind of situation.
Yeah, well, it definitely does have those benefits, fatty acids, and so I think, look, there is the potential, and it is being used that way overseas. So
okay, that's interesting. The other one, look, this might catch you a little bit off guard, but I actually curious to ask you if you've heard this, considering you deal with a lot of women and endometriosis and the rest. I've been reading in American kind of forums and a little bit, there's a few claims that there's a role for cannabinoids in I don't say sexual health, but in genuine intimate recreationally. Have you heard of any feedback like that from patients that have been taking it for female reproductive?
Oh, you mean like sexual pleasure?
Correct. Yes.
Sexual pleasure. So no, I haven't. I haven't. Are you talking more in terms of the? I suppose you're talking about just the enjoyment side of things.
Yeah, correct. Yeah. I was just curious because you're dealing with a lot of female patients. Yeah.
So no, I haven't had that feedback, but I did notice in Ethan's paper that it was used over the ages for that as an aphrodisiac.
Yeah. So well, the reports that are coming out of that, I was curious because there was one for increasing, let's say, stimulation as a topical lubricant type of product, but then there's also the added element of, for some women, apparently reducing some of the mental barriers some women might have in achieving climax, let's say.
So historically, it has been used for all of the above. So,
it probably helps men too, I'm guessing. I mean, like it would surprise me if it, only helped women. It sounds like something that a lot of but it's, of course, although there are now 90 particular medical conditions for which an approval has been given. I'm not sure whether any relate to anything intimacy. I mean, look, maybe I'm just not speaking to the right doctor. But
trials are needed.
Indeed.
Maybe your doctor would raise some eyebrows if you said, "Hey doc, I need some CBD lube." I'm not sure.
So they it was used back in the day, like in lamb's fat for that reason. So
goodness me. Okay.
Lanolin? Is that right?
Lamb's fat. Yep.
Yeah, right. Yeah, wow. Okay. Yeah. Well, that was just something I had I'd been reading about it recently, so I had to ask.
So no one's shared and no one's approached me for that. Okay.
But it's funny. But it's also the fact that that very topic is really future horizons for where we'll go in Australia. Because if you look at, it's already a thing in America. There are companies that talk about these products for that purpose. And I didn't know. Doesn't require an enormous amount of logic to think that those businesses would fold if it wasn't actually helping people who use those products. So I imagine that does sit on the horizon, but we would need to tinker with the with the framework that we currently have. But I'm just curious as well, what is your view? Just this movement towards legalizing cannabis in Australia. Do you have any reservations as a doctor around that? Do you think that THC as a compound should be something that requires, I guess, clinical supervision, or where do you sit on that?
Yeah, look, it has its risks, but alcohol has its risks. So it's probably this is where it would be so beneficial to be able to have a lot of free speaking about this. So the education sort of base and knowledge and discussion is there before that stage is reached. Would I want my child having access to it? No. As a youngster, in teens. So I suppose there's got to be some, and I thought about that. I thought, well, it was so widely used historically and therapeutically. I always thought, there was no discussion of children. So, that's my concern. My concern is that, and then, adults can provide their own informed consent and do their own research. There are many different compounds that are potentially, dangerous, but THC in our dealings with THC, we certainly know that the side effect profile is actually very low. It's really low, very well tolerated in the forms that we use. So it's
interesting because whilst by the same token, we have a lot of, part of the reason it was legalized was for epilepsy in children. We have, children with autism or behavioral disorders gaining access to these products, mood disorders, and some of them are actually getting at least small amounts of THC in some of the products. Generally speaking, it's more of a CBD play, but there are some more serious cases where we've heard of THC being applied in small amounts. So I always
see sort of pediatrics as a different ball game to adults, and legalizing for adults. I think with children, I think I would think that there would need to be some sort of medical supervision.
On the CBD side, pure CBD.
Well, I suppose, look, CBD has a very low side effect profile, so I suppose that's different. That's not the concern that we have, that anyone has. And that's not
fair enough.
The legal aspect is the THC. So
exactly.
Do I have a problem with it being legalized? I suppose bottom line is no, not at all. I mean, a lot of people are very familiar with it. They've worked it all out, before they've come to me. And the illegal aspect is what causes, I suppose, it has the problems with it. So I suppose I have a problem with the unregulated aspect of it. And then you fall into that space of, like I had when I had that CBD recovery supplement that had THC in there.
Well, did you say, was that in Hawaii?
Yeah.
So I agree with you. I think the American market has become too unregulated or too deregulated, that they don't appear to have.
So that's the issue, I think. If everything's labeled, and so it's a hard one. and in fact, that the CBD use, you probably know about the studies that CBD, when athletes use it overseas, it's, they've done that study where they got 25 or 30 different samples of CBD over the counter, and basically hardly any of them had what they said it had in it. Most of them had synthetic or natural THC. And
right.
So I think that's more the issue.
Yeah, I completely agree. I think, and we love a rule in Australia, so I'm sure we could, we can do a very tightly regulated market over here that has, all the layers of consumer product safety attached to it. And I could talk about that for quite a few hours because it's a topic of interest, but I'll spare both you and all of the listeners that are currently listening to this from that. But I want to say a huge thank you, Dr. Carolyn. It's a really interesting practice that you have, like the sort of areas that you practice in. I was thinking, gosh, if I'd been smart enough to go to med school and get through, I reckon the sort of doctor and the practice that I would want to have would be very similar to yours. So yeah, we big fans of what you do.
You suck.
Well, Mitch would be you'd do something boring, Mitch, like, I don't know, like what, cardiologist or something. No, they're not boring. But you know what I mean?
Podiatrist.
Yeah. I don't know. Anyway,
don't rag on those. Don't rag on any doctors.
I just thought I'd find a specialist that doesn't have any crossover with medical cannabis, or at least I'm not familiar with any heart surgeons that dabble with CBD in their practice. But anyway, I digress. But no, thank you so much, Dr. Carolyn. We I'm sure we'll be in touch again soon. And really, really appreciate your time, and thanks so much for coming on the podcast.
Absolutely.
Thank you. Thanks.
Hey guys, Andrew Dallin here, Mitch Kurtz, and thanks for joining us for another episode of the AltMed podcast.
Make sure to hit like and subscribe to stay up to date with all that we have coming.
All things AltMed?
Yeah, that too.
Okay.